Here we go. Hey guys, we're going live. We are waiting for our host. Let me see if I can invite her. Okay, so we are just waiting for Jillian. So we'll give her a second to come on. I just sent her an invite and then we will start. There she is.
Hello.
Hello, I'm staring at a window.
Oh, let me turn around. Oh my goodness.
Hello, pretty lady. How
Oh,
are you?
hello. How are you,
Good,
gorgeous?
good. Oh, you look so cute. Look at you. Oh.
I'm trying to, level it up here a little bit, just a little bit. But I am so thankful for you coming on the show tonight. I just want to welcome everyone to another episode of Join the Conversation. My name is Jillian, and I'm the host and also the owner of Host of the Care of Atlanta. And I have the lovely Ashley Nagirocki. She is the owner of Amare Healing Arts in New
Amare,
Jersey. So,
Amare Healing Arts. You're right.
Amare, okay,
You're right. You're good.
Healing Arts located in New Jersey, and I'm telling you all, I had a chance to this really deep dive into her lives, and I'm telling you, she is incredible. She is the expert, and I just want you, Miss Ashley, just to tell everyone your credentials because they need to know that you are well qualified to speak on this topic that I will talk about tonight, the science behind manual lymphatic drainage.
So the base, let's just dive in a little bit here. Anyone who's doing manual lymphatic drainage massage, they call it massage, but it's a medical modality. Anybody who's doing that needs to be a physical therapist or a massage therapist, and they need to be licensed in the state as such, not an esthetician, not just somebody out here rubbing people. That you have to actually get a license to touch people. So I'm a licensed massage therapist. That's like the base of it. Also, a holistic health counselor. I deal with autoimmune diseases and I specialize in manual lymphatic drainage. So I'm a lymphedema therapist working with clients with cancer, lymphedema, swelling after cancer, cancer recovery, chronic autoimmune diseases, Lyme, MS, fibromyalgia, as well as the post surgery care for like post plastic surgery, not just cosmetic, but all post plastic surgeries. So gastric bypass, hernia repairs, deep flap surgeries, cancer surgeries, scar revisions, all plastic surgeries. So that's like a little bit.
Yes, and you all see that yes, she is well qualified. And I had an opportunity. Like I said, I've learned so much from your lives and taking the opportunity before this live just to get more deep dive of information about it because from my side of the track, I do direct patient care, but it's LI Health, medical assistance, CNA. So is more so is non-invasive. So your trade and your profession is totally opposite. So I've learned so much and one thing that I've really found that was so interesting about it is that it's simple but it's very complex at the same
Yes, it
time.
is.
And it's and I think that's one of the things that sometimes people kind of underestimate and may feel that it's not needed. Anyone can do it, or many times people don't know anything about it. And so this is such a great opportunity for our guests to get the science behind the origin of where it came from and how it started and the purpose of MLD in abbreviation that we will use tonight. We will kind of interchange it back and forth and just giving people this the opportunity to kind of get more of the understanding of knowledge, the education behind it, so they can make better decisions and understand that it's not just the post-surgical care aspect, but is simply really just about the lymph nodes and really making sure that is keeping a constant flow throughout the body, which I've done my research is very important, and leads to so many different things of leukemia and so many things. So I wanted just to really ask you, the first question is what is the lymphatic system?
So
Just to kind of get
it's one of those things that you don't know exists until you have a major problem, and then you're like, oh shit, this exists. Like, oh no, what's happening? So your lymphatic system is your body's immunity, like literally the whole of your body's immunity system. Your lymphatic system is literally your waste system in your body. Now we think about waste system and we think about, like, you know, having to go to the bathroom, like having a bowel movement or having to pee, right? How does all of that get to that point? That's the lymphatic system doing its job beforehand. So the only time we ever really hear about lymph nodes, right, and know what lymph nodes are is when we're in trouble, when they're swollen, when we got to get them removed, when we've got lymphoma, which is a form of cancer, when we've got all these issues, right, when we have lymphedema from having lymph nodes removed. So we don't really know it exists until we have a problem and then we're like, oh shit, this exists and I messed up. I'm so sorry. Or if you've had chronic swelling, like if you've had like the flu or strep and it's like really big and your doctor feels and they're like, oh, those are your lymph nodes. They're really swollen. But they don't ever tell you what they are. So your lymph system, real simplified medical science here. Your blood, right, carries nutrients to the tissues. It also reabsorbs dirty blood back into your body for you to process and pee out through your kidneys, right? So long chain fatty acids, toxins, bigger particles that those tiny little blood capillaries can't absorb. Your lymph system is a mechanical system. It is not part of your circulatory system. It's not part of your blood. It's kind of like if you picture a spider web, like sitting on top of your vascular system, on top of your blood system, right? Your veins, your arteries, your capillaries, right? So these little spider webs are woven into your tissue and they are a hair thick, that's it, and a hair deep beneath your skin, and they go all the way down to the lining of your bones, the lining of your organs, the lining of your mouth. Every inch of skin on you has lymph capillaries in them. It's how your skin stays clear. It's how your body processes toxins. So we know they say, like, oh, don't use aluminum deodorant and be careful what you're using on your skin because your body absorbs everything. Well, how? Where does that go? It goes directly into your lymphatic system. It gets absorbed through your skin, and those little hair follicle, little spidery web guys have no central pump. They don't move unless your skin moves. All of your skin moves, right? So they work on this little pumping motion, kind of like a sump pump. And I actually posted a video of something called a fluoroscopy, which is where they're doing real-time x-ray imaging, where they show you on my Instagram, I have it in a reel, they show how when someone's working on the skin on the foot, all the lymph vessels start pumping and sucking fluid out of the limb from all the way up by the knee at the top of the shin without even touching it. So moving your skin, it's a skin game. It's about getting that stretch of your skin to help pull those vessels open so they absorb the water, the little spider webs. So they absorb the water in your tissue. That water is carrying all those things you absorb from your deodorant or your lotion, right? All the toxins that we're breathing in, all the stuff in your blood, all the stuff that your tissues don't need, any little macrophages, bacteria, viruses, any little things that are hanging out in your tissue. Because your body's basically a sponge. Anything that's hanging out in your tissue, your lymph system sucks that fluid out. It processes it through your lymph nodes, which are like basically big HEPA filters that filter out all the fluid and the toxins. All of that stuff gets returned into your subclavian vein. Yes, vein, which is where it mixes with blood, becomes like dirty blood, travels through your heart, your liver, your kidneys, and then your kidneys process it out and turn it into urine. That's how you get the detox from your bowels. If you've ever taken like detox pills or like done a juice cleanse or something, we're always like, oh, okay, it must be just like cleansing my organs. It's not a straight shot down. It goes in through your mouth, in through your stomach lining. Your body absorbs it into your tissues, which are basically big sponges, and it's absorbed in there. And then you take the nutrients and whatever you don't need, like those long chain fatty acids or any of the like byproduct once your body's done with the nutrients, your blood capillaries are supposed to absorb. But if those particles are too big, like bacteria and viruses and toxins and buildup, your lymph system dilates with pressure. So when you're swollen, your body has this really cool mechanism where when your tissue swells, it's a pressure gradient. So when that swelling fills up in there, those vessels open and the pressure system, as normal pressure systems go, high concentration finds its way into low concentration. So then it starts to flow into the lymph system, and the lymph system sucks it in like a little pump, just sucks it along all the way and takes it out into the blood, and then it filters through your kidneys. So your body naturally has this system, and that's how it cleans itself. Think about like a dirty sponge, right? If we're using a sponge to clean and we pour soap on it, and then we use it to wipe something down, we want to run it through with water. We want to clean it with water to make sure that that sponge gets clean. So the next time we go to use it, it's not squishing dirty stuff back onto that surface. Our bodies are the same way. Our tissues are the same way. And that's what it is. And that's what keeps our skin clear. That's what keeps our hair growing. That's what keeps all of our organs functioning properly, taking out that cellular debris, taking out any of the bad guys and peeing it out. That's how you get the toxins out of your body. We know that. But the lymph system is the crucial part before the kidney and urination part. The lymph system is what gets all those toxins to your kidneys to be excreted out. So your lymph system is the secret behind your immunity, clear skin, healthy hair, healthy bones, tissue regeneration. If you don't have a clean space, a clean surface for your body to create those new cells, it's going to start going haywire. And again, with that pressure gradient, if you have too much swelling sitting in there and your body can't take it on because it's so much, and again, it's a skin game. If you're not moving, if you're not hydrated, if you're not moving your body, and like with manual lymphatic drainage, which we'll get to, we are doing nothing but moving the skin. So massagers that use oils and just glide over the skin, you're not really moving it. So it's about moving your skin to dilate those little sump pumps to get your body to suck that fluid back so you can pee it out. That's how it works. And that's how your lymph system is naturally designed on its own. So it's not just by breathing. It's not just by your heart pumping. You have to physically get up and move your skin and move your body to get that stuff to pump up and out of you and get moving. That's a little synopsis.
Well, that's amazing because so many of us don't and how important movement really truly is, that our bodies were built to move, not to sit still for too long, because like you said, the body needs to keep flowing. It keeps in, that's a way of cleansing out. So that's really fascinating. That was a lot right there. So
I try to condense down as much of the science as we can so that it's like bite-sized chunks so we can understand it.
But that was really good because that's the science, that's the anatomy of what's in our body is leading up to the reason for MLD. So with the lymphatic system, when it's not operating correctly, because we're not moving, and you said it start causing swelling, how does the MLD assist in doing with reactivating the body to say, oh, I'm moving again? So how is it beneficial for the human body?
So your lymph system on its own recycles and pumps out 2 liters of fluid a day, right? And some of it you pee out, some of it gets recycled and reabsorbed and used, with healthy white blood cells, proteins, fats, loaded up with all that stuff, right? That's what your tissues are loaded up with. So normally, right, in a normal healthy person, we drink a lot of water, we pee a couple times a day, our pee gets clear, and we're like, okay, cool. Like, I know my body's clean. I don't have any, like, smelly, funny, colory, weird things coming out of me. Like, I'm good, right? That's how we generally know, like, oh, okay, we're good. Let's say we go out for a night of drinking. We wake up with a really puffy face and puffy eyes. Why is that? Because all of the sulfates from the wine, all of the dehydration from your tissues, all of the alcohol byproducts, the sugar, whatever else is in there that you're drinking, your lymph system is swelling because it's trying to filter all that out. So when you're seeing that swelling, it's because your tissues are engorged with that lymph fluid trying to clean out all of that. So then you'll feel like hungover and like poop for the next day, and you're like all groggy and your face is all like puffy and it's tender and it hurts and stuff. And then throughout the day, as you drink water and you move and you talk and you know move your face and you get up and you walk around, that starts to come down and your skin is back to normal, your head is now clear, and you're peeing all those toxins out. So when it comes to normally, when the lymph system is like, let's say, bogged down, right, with stuff that it's trying to get rid of, normally we'll drink water, we'll walk, we'll move, and it'll work, right? But what happens is when we have a problem, so when we have excessive swelling that stays, let's say you stub your toe. When you stub your toe, it swells, right? And then, you try to stay off of it, you move, you rest, and within a couple days, maybe within the day itself, depending on how bad it was, it goes down on its own because your lymph system, because of that pressure, is dilated so much that it's taking all that in to clear it out. What happens when it's not dilating? What happens when there's so much fluid, like from kidney failure or heart failure, where your body blows up with swelling because, again, those things that are normally functioning to take that out isn't there. Through COVID, when everyone was sitting around and say they gained like the COVID pounds, that's swelling. You're not moving. Some people lost it. Some people found it. A lot of it can be diet, but a lot of it is you guys aren't up and moving. You're not creating that physical pumping motion from getting up and taking a walk every day, or like you would move regularly when you're going to work, like you would move regularly when we're allowed to go outside and do things. So your body normally pumps that stuff out by walking, by, exercising, by just even doing laundry around the house, even walking up and down stairs. Anything that moves your skin like that, that pumps your skin, is going to activate your lymphatics. And that's how we're designed to work. So when we get into those situations where it's a kidney failure or a heart failure, or you're having persistent swelling in your ankles because it's hot out all the time, and you're working a desk job and you're commuting 3 hours to work, you're not getting any of that pumping motion from your ankles. You're sitting at a desk all day, locked up. So there's no pumping motion happening in your body, which is why a rebounder is one of the most amazing things for lymphatics, because you're pumping your whole body. Your skin is being jostled up and down, up and down, up and down the whole time. Even if you're just doing bunny hops, even if you're just taking like little baby hops, your heels aren't even leaving the rebounder because you're getting your skin to pump, you're getting your body to pump up and down. So when we get into complicated situations like cancer recovery, where we're not moving, surgery recovery, where we're not moving, you can't move, after pregnancy, where you're tired and you're not moving. I know you know this. One of the first things I tell you right out of surgery is you got to get up and move. Like, we got to get you ambulatory as much as possible, because again, we're getting that blood flow, we're getting that lymphatic flow, we're getting everything moving. The problem is stagnation. Stagnation from, like I said, not moving in COVID. Maybe you're sitting all day and you're just hanging out. People who have gone through cancer recovery that have that excess accumulation and they're so fatigued, they can't move like that. Even, I work with some autistic adults, even with them, where they don't want to move, they don't want to do a lot of activity, they develop lymphedema or edema, regular swelling, and we'll talk about the difference between the two in a little bit. But with something like that, that's more of the pump is not happening. Then there's the other side of the problem with a heart failure or kidney failure, where your body is swelling up like crazy because something is broken, something's not working, something stopped working. So your body fills up with all of that edema and all that swelling. And again, you just had a major thing happen. You can't move on top of a secondary event causing massive amounts of swelling. Let's say you get a wisdom teeth pulled, right? You're gonna have a lot of facial swelling and you're numb, so you're not really talking and you're not really moving. That swelling's gonna sit there for a little while. After plastic surgery, you can't really get up and move very much because you're really exhausted, or your faja's cutting into you like crazy and you don't want to move. And all of that secondary post-surgery swelling is just sitting, and we're not activating the pump, and we have a volume issue. So there's a couple different things that that's a problem with. Now, manual lymphatic drainage is me manually pumping your skin to open those water gates. That's all we're doing, to open those little vessels. We're not pushing fluid. We're not rubbing or scraping or doing any of this craziness. It's not any of that. Because again, the way that it's medically designed, the way that Dr. Emil Vater, the guy who created this, found this whole thing to work is that there are these little water gates and they need to be dilated open to let the fluid in, because the pressure gradient. So they dilate them open, the fluid goes in, and your body starts to take care of it on its own. So all we're doing is manually opening those water gates and letting them open and letting them have that rhythmic pump and that rhythmic stretch and that rhythmic pulse. So it starts like these little Pac-Man sucking in fluid all the way into your body to travel it along this very intricate system to get to your kidneys so you can get rid of it. It's called decongestive therapy when you're doing it for like lymphedema and things like that. So this guy, Dr. Emil Vater, I mean, it goes back way before him, but he's the one that kind of put it on the map in the 30s and was like, hey guys, there's this thing. He took it to the medical board and he was like, hey, if we mimic the same motion that these vessels are doing right on them, on the skin, this tiny little gentle pump, that's it, along the vessels, just to stretch the skin and release. That's it. It's so gentle. If you're doing this, where you're seeing the skin bunch like that, all of these vessels are not going to contract and release. You're just pressing down into the body. It's about a contract and release. So it's just the skin contract and release. Just the skin contract and release. And it's in a certain pathway, in a certain pattern to be able to open up these little vessels to get them to start activating a lot more so that your body can start dumping out all that fluid. But this guy found this and he was like, hey guys, this is the thing. Like, look at this. It works. Here you go. For cancer, for lymphedema, for swelling, for, fibromyalgia, for all these complicated things that have swelling attached to them. Any condition that has swelling attached to it as a symptom, this works. Here you go. Even for hangover face. Here you go. And the medical boards were like, please, we're not like cutting people open. That's not real. And this is like the 1930s. So they were just like, we're not about it. Take it somewhere else. So he took it to the esthetician boards. Now this is in Germany. So he took it to like the cosmetic boards and they were like, oh yeah, this works wonderful for wrinkles. This works for face swelling. This works for like all the cosmetic stuff. This is amazing. So this is in the 1930s and he's like, all right, bet. There you go. And then a couple other people found him, Gunther Klose, and a couple other like names out there that have lymphedema, that have lymphatic schools. And they were like, oh shit, this works for like all the health stuff. Oh wow, this is awesome. Let's start teaching this to people because this can change the world. And there are a lot of conditions where, like after kidney failure, like after heart failure, like after liver failure, where the body is so overwhelmed that this is decongestive therapy. It decongests the body so it can start healing and it has movement and it's got room to heal and it's not bogged down by all this like swelling and dirty tissue and all of that. So MLD, manual lymphatic drainage, is us manually stretching the skin to mimic those vessel movements, to stretch those little water gates open and get them to start pumping so they can start pumping all this water out of you, all the swelling out of you, so you pee it out. So that's what MLD is. That's what it was designed to do, manual lymphatic drainage. We are manually pumping the lymphatic system to get the drainage to happen on its own. That's it. That's all it is. That's all it is. But it's very, very intricate and very, very delicate. And that's the thing. It's like, oh, it sounds so simple, right? I'll just do this. Okay, but if you have a condition and you don't know you have a condition and you start pumping fluid into a place, your arm's going to blow up. Your face is going to blow up. Your chest is going to blow up. Like your lymph nodes are going to get overtaxed and overwhelmed because you're now pushing fluid into places that are already having an issue, which is why finding somebody after surgery, or forget after surgery, if you have a lymphatic complication, if you have chronic swelling, if you have an issue with swelling where it's like, okay, this won't go away, it keeps flaring up, what the hell's going on? I don't know how to stop this. The doctor said I'm fine. They did all the scans. I don't know what's going on. Don't just go to someone who does MLD. Go to someone who specializes in it. Go to a lymphedema therapist. Go to someone like me who knows how this works in and out. Because if you start trying to mess around in there and you start overwhelming lymph nodes, or let's say you have an infection and you don't know, or something's going on and you're not sure of what's happening, and you start pushing fluid into places, again, that fluid is going back into your blood and into your organs. You can very well overwhelm your body and spread an infection like wildfire if you don't know what's going on. So this is why I, especially after surgery, when you guys are like just now off of your antibiotics, I'm like, hi, please don't touch yourself, because you don't know what you're doing or where you're pushing things, and God forbid there's something wrong, you'll have no idea what you did, and it'll be a really big problem. So going to someone like me who knows the map inside out, who knows where the bottlenecks are, who knows where the watersheds are, who knows where the vessels are, who knows how they flow and the exact pathway and where they are on your skin, like little spiderwebby maps, and how they go internally and where all of that drains to and everything. That's where that comes in, is having someone that knows the ins and outs of the lymphatic system and what makes it react and what makes it swell up and where that little nexus event was that caused this crazy, massive, out of control situation of swelling now. It's finding somebody that knows all of this. And it's really hard because, again, when people hear MLD, they think, oh, you're going to manually squeeze fluid out of me, right? No, this is manually triggering your body's sump pump. That's all it is. We're not doing anything like that. And as massage therapists, even physical therapists, and even nurses like you, right? We don't do that. You can't, no, that's like not a thing. And again, because a lot of people don't really know what it is, so they hear manual lymphatic drainage and they think, oh, you're going to manually drain me. But we're manually opening those gates for your body to drain it, and you pee it out. So that's how MLD works, and that's kind of how it was created. And when Dr. Botter created this, and there's the Foley Clinic in Germany, which is a clinic where you'll go in and you'll say, hey, I got a swelling issue. They will put you on a strict regimen as far as food. You'll stay there. They'll have you do aqua size every day, because hydrostatic pressure is the number one thing for swelling, which is why when you jump in a pool, 5 minutes later you have to pee, because your entire skin is being pumped all at once, everywhere, every inch of skin, because that water is hitting the edge of the pool and hitting you, and hitting the edge of the pool and hitting you. And it's that same rhythmic pumping motion. Same way on a rebounder, it's that same rhythmic pumping motion. Same way with ballet, it's those same rhythmic opening and closing. Same thing with yoga. Anything that's fluid like that, with a pumping and an opening and a flow, is going to be good for your lymphatic system. Same thing with MLD. People make fun of me all the time because I'm always like, la la la, la 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 la, feeling the flow, like I'm all up in it, and then I start like going with it, and I'm like, oh, this is so nice, it feels so good. But anything that has that, so when they have you in this clinic and you have an issue, they first start with a live blood culture. So they check your levels, they check where your toxins are and all that. They get you on, a diet that's clean, all like not raw, but natural foods that come from the earth, no food byproducts, no plastic products, no preserved products, no packaged products, no food-like substances. If it doesn't grow from the ground directly, it's not going in your body. If it's not in that pure form, you're not eating it. And it's the same thing when you're under our care. I talk to you guys a lot about, hey, if it's not coming from the earth, don't put it in your mouth. Do Cheerios come out of the ground? No, so we're not eating Cheerios. So anything like that. And then people are like, what about cheese? It's natural. I'm like, does cheese grow on trees or plants? No, so we're not doing that. Anything that is a plant, a fruit, a spice, an herb, meat, we're good. Water, we're good. Herbal teas, we're good. All of that is fine. But anything other than that, the food byproducts, they cut all that out. They have you in bed at a certain time. They make sure that, you're getting checked, your levels, toxin levels every day. And they're doing MLD on you every day. And they're cleaning you out. And they're checking your levels while they clean you out. So anybody that has like a huge lymph issue, like crazy chronic lymphedema or something like that, fly to Germany, get all that taken care of, and then you're good to go, because they do all of this in real time. The same way that fluoroscopy that I have on my Instagram shows you the real-time lymph movement. They do all of this actively. And what we've mimicked at Amare is the same thing. When you're under my care in that first session, 3 things I talk to you about immediately: salt, water, movement, immediately. First 3 things. And we dive deep in that first session into what you're eating, because what you're putting into your body is being absorbed by your lymph system, and you may be bogging it down. 2, what you're drinking, because it's not always what you're eating. A lot of times if you're drinking soda, if you're drinking coffee, if you're drinking normal substances like water or something that's lighter, that's going to bog you down. And then we talk about movement because, again, the lymph system is absorption of what we eat. It's a pumping movement, actually getting you to move it on your own. And then we talk about your nexus event of what crazy spider web of health issues that you had that caused this major blow up. Where did it start? What was the trigger? How did it happen lymphatically? So obviously something like cancer, that's where it started. Something like autoimmunes, that's where it started. So there's always something. It may be a medication that you're on that has a side effect of edema that caused it. There's always something. And if we can find out what that thing is with my mapping of the lymphatic system and how it works in my brain and my background training and holistic health and all of that, we can kind of figure out, okay, these are your triggers. This is how this happened. Do we need to just clean you out because it's old swelling? Or are these triggers that are constantly igniting your lymphatic system because you're allergic to something and it's causing a histamine response? Are we there's so many different ways that MLD can be used, but there's also so many different little things that we need to be careful of. Like, again, active cancer treatment, infection, cellulitis, things like that. So it's all well and good to say, oh yeah, I'm just going to go get a lymphatic massage because I'm feeling kind of under the weather. But if you're now starting to get a cold and your lymph nodes are trying to fight it, and you start pumping all this fluid through, you're going to spread that bad boy everywhere if it's hiding in your tissues. So if it's dead, we're off the antibiotics, we're good, we're just cleaning out the dead stuff. MLD is used for recovery. It's also used to clean up the body and detox. So after surgery, after cancer, after you've gotten over your cold, after all of that stuff, to help with cleaning up the sponge so that it can filter better and so that it can absorb better. You can't absorb with a dirty sponge. So absorbing your vitamins, absorbing your medications, absorbing nutrients, all of that. So we're basically the cleanup team for your body and your skin. And that's what MLD does, is it cleans out the body. So you will have that toxin push sometimes. You will get really tired sometimes. Your skin will smell funny. You'll be super thirsty. You'll get a little bit of grogginess because you're going through the same toxin push that you would if you did a 17-day juice cleanse where you would feel it for 17 days. We're doing it right now in real time, cleaning it all out immediately, pushing it right out of you. Your body's pumping all that out like a sump pump, and it's going right out through your urine. We're not waiting 17 days for all that stuff to eventually process because your lymph vessels only pump 10 beats per minute. That's it. And it's trying to filter out 2 liters of fluid all day. So it's 10 beats per minute over the course of a full day. We get it sped up and dilated to 110 beats per minute over the course of 24 to 48 hours. So the minute I stop dilating your system, it's going. And then over the next course of the 24 hours, it's going to start slowing down and getting back to its normal rhythmic pace.
So it's like a heartbeat, like another heartbeat, right? Throughout our body.
No, because it doesn't have its own pump. It's not beating. If you're not moving, it's not beating. It's not moving. It's not going anywhere. So unless you are pumping, moving, doing the rhythm, making the motion, doing the full body skin movement, which is why dry brushing helps because you're moving your skin. Here's the problem with dry brushing though. Little nugget here. Guys, if you're doing this, it's not really doing much because again, we want to move the skin. So micro pumps to move the skin. And then using a dry brush lymphatically, I teach you in my sessions, in my virtuals, how to do that towards the specific areas where you're having issues, towards specific lymph nodes. Because again, if you don't have lymph nodes in an area because of cancer and you're pushing fluid there, there's nothing to catch that fluid. There's no HEPA filters. You're going to blow up. So it's a very, very intricate little spider webby thing, and you got to be careful with it. And that's why you got to find somebody who knows the ins and outs of it really, really well and has studied the system itself to know how those vessels work.
And that's so interesting because when you were talking, when you were speaking about the complete digestive therapy with the compression garments, I know that we pretty much know it in one aspect of that is in with cosmetic work, but it's way before that is with oncology surgeries. There's different things and how really understanding that that is a form of MLD, but you have to know how to properly use it, like you said, because if not, you will actually do more harm than good.
Absolutely.
Where your fluids in a place where you're starting to swell. I know a lot of ladies are doing the waist trainers or the different type of garments where they want to get their body looking a certain way. But there's a science behind that of MLD that you want to really understand how your body flows, the chemistry of it, because everybody bodily chemistry is different. So it's very important to understand that your body is uniquely designed differently from your neighbor. So you cannot just look at someone on social media or on TV or your friend or even your family member and say, oh, I can do the exact same thing, because your body is going to respond differently because of its own chemistry.
Well, it's not even just the chemistry, right? So this invisible spiderwebby lymph system, right? These vessels are a hair thick. They can be broken by just a cut that's a millimeter deep, by like a tattoo needle. You can break vessels. Those vessels don't always grow back straight. So they're like this, and they pump, and they open, and they close. Sometimes when you break those, they grow back like this, and they're squiggly. And then when you go to pump and open and close, they're not straight anymore. That fluid's not going in a straight line. It's like leaking out into the tissue. It's missing its mark. It's all over the place. So as a therapist, you need to be able to look at, okay, how many surgeries did this person have? Where is their scar? Do they have internal scarring? Do they have internal tissue damage? Did they break their ankle, which will break vessels? Did they break their foot, which will break vessels? You have 650 to 700 of them. And again, they can grow back scriggly, or sometimes they don't grow back. And then you have what's called lymphedema, or chronic edema. There's a couple different things we're going to go into with that, but it's not always just like a straight line where it's like, oh, okay, I have swelling, I'll just charge my lymphatic system with it. It's not always that simple. So people have been through different things. If you've had a C-section, you've cut right across your hips, which is right where your inguinal lymph nodes are, which is one of the huge sites for lymphatic, drainage. That's where all of your pelvic lymph nodes hide, right? So you got to cut across there. Baby came out. You got lots of tissue damage in there. Everything's trying to regrow. Those vessels are trying to come back straight. Lots of mommies after a C-section wind up with the kangaroo pouch, the little pooch, the baby weight they can't get off. Well, here's the thing. That very well may be swelling and not weight. Because if you put it on like that within a week and it never came off, that might be swelling because you just cut across one of the major lymphatic highways where fluid drains from your abdomen, and now you have a scar in there and you've got tissue damage. Your lymphatics aren't going to be working properly. So what we need to do is do the lymphatic drainage, and I need to know all of this and look at all of this and say, okay, so these are probably damaged and this is old swelling from when you were trying to heal. I'm going to engage the lymph nodes around your hips, around your legs, around your abdomen, everywhere else where it's not broken, to be able to get that to activate, to start draining this area, because the lymph nodes and vessels in that area may be compromised and not be doing the job. So if you just try massaging and rubbing yourself, you're just pushing fluid around in an area where there's nothing to catch it. So I have to dilate everywhere else and get your body to start sucking it out of that area and getting vessels employed and nodes employed to catch that swelling when I start moving it out. You can't just move the swelling around and expect it to be okay. Because again, if you're doing something like regular massage where you're just oil rubbing, you're not dilating those vessels to reabsorb the fluid. Are they getting stimulated? Yes. But are they getting dilated? Don't really know, because I'm not the one doing whatever you're doing as far as rubbing yourself. But are they getting stimulated? Yeah, they're pumping a little bit faster. But as far as that guided dilation to get that fluid to go to healthy lymph vessels and nodes to be reabsorbed and peed out, unless you know what that is and where that is and how it is, and it's different, like you said, for every person from what they've been through. Let's say you had a lumpectomy done and everything was fine, but they took out a lymph node. This may be compromised, and you had a C-section. I can't go up this way. You're compromised. You at home know none of this. So you're going to be rubbing and pushing and doing things. And I hear very, very frequently all the time from my clients that I was trying to do the massage, but it just felt like it was getting worse, and I felt like I was swelling even more. Now my back is swollen, and I don't know why, because it's a bag of water with little spidery webs in there that dilate and suck the water out of the bag and then you pee it out. If you're not dilating that spider web, you're just pushing around a bag of water in that area. And it's your whole body that's a big sponge in a bag of water. So you can very possibly, and I've seen it a lot of times, and even garments, push fluid into areas you didn't have surgery, like your thighs. Push fluid into areas you didn't have fluid before, like your pubic region, like your lower back. You had no surgery on your lower back, but your lower back is a rock and it's swollen because your garment pushed all the fluid back there because of the way that it was cutting into you, because it was cutting into you. So there's things like that.
So in that reason,
I'm just gonna turn on my light real quick.
Okay. Is so if someone that had surgery done, as in, for example, oncology surgery, and they remove a good bit of their lymph nodes in the area of their axillary area, and also one area on the left side. So really, with that, we wouldn't really need to test this side because it's going to it's going to trigger inflammatory.
That side is a huge contraindication, and that's the thing that a lot of people don't realize when they go to get a lymphatic massage, or they say it didn't work and I'm still swollen, or like I went to do this and it didn't work, probably because the therapist wasn't taking any of that into account because they don't have the in-depth training to do that. They just did a standard MLD course, learned the technique, and that was it. They didn't do a CLT lymphedema course. They didn't have all this background knowledge of the intricacy of how the system works. So I hear a lot of times with cancer, because I do a lot of cancer recovery, a lot of times with cancer where they'll go to physical therapy and the therapist will just do the one section that's swollen. You have no lymph nodes here. It's not going to go anywhere. It's just going to build up and then spread because you're moving it around, and then it's finding other areas in that sponge because this part of the sponge is full. And if you hold a sponge that's full on one end, all the water drips down. It's the same thing. And then all of a sudden your whole arm and hand is blown up out of nowhere. I had a client who came to me after cancer, lymph node stuff, got it all taken out, got it taken care of, was cleared, right? She came to me and we got her in 2 weeks. No problems. Hand was blown up, arm was blown up. Completely gone. Didn't even need a garment for maintenance. Compression garments are used for maintenance for lymphedema. Didn't even need a garment. So we wanted to get her a garment just so she could have it because she needed, for regular maintenance, right? Just in case. She goes to a PT to get a script for this. She had to go for 15 sessions before she could get the script. She went for 15 sessions. I didn't see her for a year because she was perfectly fine through the heat, through the winter, through everything. Perfectly fine. Gardening, being active with kids, totally fine, right? She goes to this PT. She comes to see me after a year. Her arm and hand is more blown up than I have ever seen it before. And I said, what did you change? What did you do differently? Have you been, sleeping on it? Have you been doing anything? She said, no. She said, I know exactly what happened. I started going to PT. They were making me do exercises. The exercises were whatever. They weren't really helping. It was fine. My arm was fine. We did the maintenance when we did it 9 months ago. It's been fine since. The session where she started touching my arm and pushing fluid is when it started blowing up, and it dripped all the way down. Her hand was a balloon. She couldn't close her fist. She couldn't even bend her fingers. Her whole arm was blown up. 4 sessions, 1 a week, because she's also pregnant, 1 a week, and she's perfectly fine. Back to normal. Everything, no garment, no wrapping, nothing, totally perfectly fine. But again, it's very, very subjective to every person. Because did I work in this area? No. But did I move the fluid from her hand up across her back and across her chest where she has lymph vessels and she has those pathways? Yes. But again, that's because I have the knowledge to know where those pathways are to redirect. The PTs don't get that training. They don't go to school for that unless they go to an actual lymphedema 145-hour course. They don't know. And it's not their fault. It's not part of their training. But then they're doing these things and causing more issues the same way you guys at home are doing the massages yourself, and then you're winding up with massive fibrosis, or you're winding up with really swollen parts that didn't even have surgery on them because we're not really taking into account all the other parts of the lymph system. And it's so intricate and it's so tiny, and it only takes a little bit to make it go really, really wrong. And that's kind of a big part of it with the cancer recovery stuff, is that a lot of the PTs, at least in New Jersey, and I know a lot of really good PTs that are lymphatically trained and know exactly what they're doing and are perfect at everything, and I love them for it. But there are a lot of them that aren't. And because it's covered by insurance, you trust them and you go, and then you wind up with more swelling and you're like, oh, well, MLD didn't work for me. Well, it wasn't really MLD though. It wasn't the real thing because they didn't really know all this stuff and they didn't really explain how any of it works to you. So do they really know? Because if they can't really explain it like this, do they really know?
So, with that saying, when we have the primary leukemia and we have secondary leukemia, and secondary comes from like surgery or different things. So, when it comes to that, then now we're dealing with okay, someone has surgery and their lymph nodes in that area has now been disrupted and now it's not able to regulate normally on its own. So if someone is touching that leg or they're not even getting any treatment, because we do have those that they're not doing anything. They're just like, well, I'll just deal with it and then it swells up. So with that, with the MLD, is it possible for the MLD to help that when it comes to
Absolutely. So when we're talking about like cancer surgery, yeah, a whole bunch. And another big part of it is a lot of people after cancer have the swelling and their doctor's like, oh, you're just going to have to live with it. Sorry. And then maybe one day it's like, okay, you're like, all right, it's not really bad. So I don't really, it's okay. I can like live with it. And then one day you're in the heat and you're lifting really heavy groceries. And all of a sudden the next day your arm is blown up and throbbing. You go back to your doctor and they're like, oh yeah, go see this PT. Then you go to the PT and the PT does that little lymph thing that's not really MLD and in depth, especially if it's only like 5 minutes on one area, you're not even engaging the rest of the lymph nodes in the body to get the system to work. Then you're just kind of like, okay, well, this didn't really work either. Then they put you in a compression garment without getting you down to your baseline. So the compression garment, the baseline of the garment will always keep you at your swelling because that's the baseline because they didn't do the decongestive therapy. And then you're like, all right, well, this is going to have to be it for the rest of my life. No, if we get you down to baseline and we get all that fluid out, we can measure you for a garment where your arm is the smallest or your limb is the smallest that it is, that it's going to be, keep you at that baseline. And now your garment holds your baseline as maintenance. It's not going to say that you're not going to swell. If you're missing lymph nodes, yes, you're going to swell. If there's, if it's really, really hot out, if you've had a lot of salt, if you've lifted something really heavy, if your diet hasn't been great, like if you haven't had enough water, there's a lot of things that can trigger swelling with that. But that's not to say that we can't help. MLD absolutely helps. That's what it was designed for. And now that's like cancer surgery and stuff. When we're talking about primary lymphedema and secondary lymphedema, lymphedema is your lymph system having a problem where it can't handle the volume of swelling because of two things, a mechanical insufficiency or a volume issue. So mechanical insufficiency is, again, you're missing mechanical parts to make that pumping motion happen and filter it out, or that swelling is too much for your body to process out on its own. So we do the MLD to help open and dilate the vessels so that your body can handle all of that fluid. So,
and that's the fluid, that's the plasma protein. That's
yep, the plasma-rich protein, absolutely. So with secondary lymphedema is because of a secondary cause, or just not even lymphedema, because lymphedema is a lymph system, really big thing. That's like, we're going to have lymphedema. This is like a thing we need to be aware of forever. With edema, like after plastic surgery, just swelling. Edema is just a fancy word for swelling. With swelling, it can happen from surgery, localized trauma. That swelling is there because of surgery. You can agitate that swelling. You can make it thicker and angrier and more volume of swelling, but that swelling is there because of surgery, not because you have a major health issue. So that doesn't have to be permanent. That can absolutely go away with MLD. Same thing, with a regular injury. Let's say you had a rotator cuff surgery, right? The swelling is here and you don't have full range of motion yet because it's still heavy and swollen. We can get rid of that and it's gone. Poof, you peed it out. It doesn't come back. It was caused because of surgery. But when you're having something like a Lyme flare-up or fibromyalgia or, any of the things that cause constant inflammation, constant swelling, that's something that's kind of a primary cause. Like that's something we're going to have to continue dealing with. Or if there are some people who are born without lymph nodes, who are born without lymph vessels, their body just didn't make them. That's going to be primary, and that's going to be, you're going to have to deal with that for life. We're going to have to structure your diet, structure your lifestyle, structure all of the lifestyle stuff around being conscious of this and making sure that it doesn't get worse, and teaching you how to manage and maintain on your own. You shouldn't be in my office every 3 days because you're having a blow up or a flare up. That shouldn't happen. You should be able to maintain this on your own. And it's a lifestyle change, and it's a diet change, and it's learning about your body and all this stuff. But primary is like that. It's a primary cause. It's a primary thing. It's going to be there. Secondary is like an injury or a surgery, or even pregnancy is a secondary. Swelling from pregnancy is secondary. It's a secondary thing. It's an event that happened to cause that. And in that case, that swelling, once it's gone, it's gone. It doesn't come back. That's it. It was caused because of an event. It was stuck in there because of the event. We're done. We get it out. You're clean. You're good to go. Done. Primary is something that we're going to have to continue dealing with and working on because it's a primary problem. So it's something that's caused by something else. Like if you have a heart attack and your legs blow up, that's a secondary. It's an event. But if you were born without lymph nodes, or you have some sort of condition, like I have a client who's born with Lyme's disease since she was a baby, that's going to be a primary issue. So there's a lot more to it. That's just the easiest way to simplify it for everybody to kind of understand. So, yeah, there are lots of people that have this swelling, and once it's gone in the end. Done. That's it. Beat it out. It's never coming back. It's in the toilet. You flushed it. It's gone. It's not coming back. That's it. It was stuck in there. It was in there because something was broken. It was trying to heal it and buffer it and protect it, like with a stub toe. Your body couldn't handle the capacity for whatever reason, and it just held on to it. We do the cleanup. We clean all that out.
Well, I'm going to tell you, we cover a great bit of information that I know that our audience is definitely, I know that you all were taking notes. If not, you can definitely get the replay. But we're like 9 minutes from the top of the hour. And I just wanted just to give you an opportunity to tell everyone how they can reach out to you, how they can get your resources, your services, because you have a wealth of knowledge that's going to really save a lot of people's lives, save a lot of people's lymphatic systems to where they're not destroyed or disrupted, but actually help it to get it back where it will regulate more of on a regular by itself. So just take this opportunity just to let everyone know how can they reach out to you.
Call the office. I know we talked about this. You watched enough of my videos. You know what I'm going to say. Call the office, guys. You are going to get the same automated DM response every God blessed time. I am in session almost 12 hours straight a day. I am not the one running the Instagram. I popped on here because Jillian was like, yo, we got to do this. And I was like, all right, bet we're doing this. And that was it. She's the reason I'm even on here. So call the office, 732-841-0142. Happy Alex will be able to give you information, help get you scheduled for either a virtual if you're not in New Jersey, or a session with me if you are in New Jersey. That's really it. There's no other way. Our YouTube has all these videos. This video will go up on our YouTube. The full video, like a snippet of it will be on the Instagram, but to watch all of our full videos on everything, you gotta head over to the YouTube. Instagram is like, hey, you have too many videos. So we were like, all right, cool, we're going to YouTube. So they're all on there. It'll also go up on the podcast. We have Spotify, Anchor, and Google Post-Op Podcast. That's what's called, the Post-Op Podcast, I believe. Okay.
Okay, I can go follow you on Anchor.
Yes, we're Anchor, Spotify, and Google, the Post-Op Podcast. So we talk about all this post-op stuff, not just for plastic surgery, like tummy tucks, hernia repairs. Like, just because it's plastic doesn't mean it's like BBL lipo cosmetic. Like, there are a lot of people that need breast implants from breast cancer, or they have an expander from breast cancer that, like, you know, they're working on getting stuff in there, or a fat transfer, or, you know, whatever kind of surgery. It's all healing stuff. So the YouTube, Amare Healing Arts. the podcast, the Post-Op Podcast. Call the office, 732-841-0142. And that's it.
And I thank you all for joining us tonight. Thank you, Miss Ashley. Oh my God, I have learned more. I hope that you all are convinced that she knows her stuff. She is the expert when it comes to this. And I truly do believe that she would not steer you wrong, but definitely steer you right to the light of knowledge. And you will be so prepared for any type of surgery that you're going to have. And so we're going to sign off from here. Is 5 minutes to top of the hour, but thank you again, Miss Ashley. And we will be
Thank you for hosting.
Thank you. And I will stay tuned in to your channel because I definitely have so much more to learn, just so I can just be more abreast of what's going on. So who's down here in Atlanta, I can connect with and kind of get school on some things.
Yes.
So
Goodbye, love you.
New Jersey, so definitely have to do that.
Yes,
so.
Absolutely. Well, thank you very much. Have a good night. Bye.
All right, bye.